My name is Terry Ragsdale. I am the Program Manager of Parkland Health Center Senior Support, which another name is our Geriatric Psychiatric Unit. We do take patients 55 and older with a lot of different types of problems. Most of the problems we see are dementia, some bipolar, a lot of depression with suicidal ideation. When you have a loved one that is becoming depressed, and they start talking about they don't want to live anymore, then that should be a big sign for the family to think, okay, something's going on. You should bring this patient to your provider, which could be your psychiatrist, your primary care physician, or to the emergency room. Because when they use what we call those buzzwords, I don't want to live anymore, those are the things that makes our radar go up. So make sure that please, anytime you have a family member, no matter what age, that starts talking about they don't want to live anymore, that is a very important sign to get them help. And when I mean get them help, I mean get them help now. There's so much stigma out there about mental health. An old friend told me one time, you can't cut off the head to treat the body, and you can't cut off the body to treat the head. We're all one and the same. Those depression with suicidal ideations, it could be a medical issue, and it could be a mental health issue. It could be both. So that's very, very important that you do get someone to see their health care provider, preferably a mental health provider, but most of the primary care physicians, they recognize mental health when a patient appears in their physician office, and they will call us or the psychiatrist. We have had some people, many people, well, in the world, United States, that tell their family, no, I would never do that, I'm fine, I'm just got to think through this. But sometimes we need help. We place patients on antidepressants to help them get over this. And then a lot of times people will quit taking their antidepressants because of some of the physical aspects. Some people have more physical side effects and some people don't. So a lot of people, what do? They quit taking their antidepressants and then they're back in that same category. So even if you start feeling well, make sure you continue taking those medications and talk with your physician. I always tell patients, if you have cancer and you are taking a chemotherapy drug, are you going to quit taking your chemotherapy drug because it makes you feel bad? No, you're going to continue taking your chemotherapy drug until you get maintained. And it's the same way with mental health, whether it's depression, dementia, or any other type of mental illness. We see a lot of people, especially the elderly population. Of course, I have to watch this because 55 and older, you know, sometimes it's not really an elderly population, but a lot of times you'll see people with a urinary tract infection, and in all the books it says people, when they get urinary tract infections, can start having more dementia or more depression. And they say, well, we'll just treat the UTI and send them on their merry way. Sometimes that works and sometimes it doesn't. You have to look at the whole picture from head to foot. And as I said, and I can't reiterate this enough, you can't cut off the head to treat the body, and you can't cut off the body to treat the head. So please make sure that we feel that if we have a loved one or even a neighbor that start acting a little strange or different, you know, they're more depressed or getting forgetful, that you call your mental health provider. There are so many people out there that have that stigma. It cannot happen in my family. It cannot happen to my best friend, because there's such a stigma out there still to this day. Even with all of the education we've done, there's still a stigma. In my secure classes, I always ask my audience, secure is like a de-escalation and kind of protecting yourself module. I ask my audience, who in here has never been depressed a day in their life? Who in here has never had an anxiety moment? Well, of course, no one can raise their hand and say they've never. Those are all some type of mental health behaviors. It's just most of us have better coping mechanisms, but even though I feel like I've been told I'm a very strong person, But you know, there's sometimes if you have issue after issue after issue, sometimes you need help with those coping mechanisms. So that could be a visit with your counselor, the psychiatrist, or even medications. So please don't let any type of different behavior go unnoticed. Thank you.